Welcome everybody that's in live in person and in Zoom. Welcome to another BHL Presents. Today our topic is psychedelics, and it's Basic 101. And we thought rather than having slides and all kinds of different parameters to highlight this subject that is inquiring minds want to know, we thought that having two experts in the field that's been in many different psychedelic conferences, podcasts, come here and join us. So my dear friend Julia Mirer has worked in the psychedelic space since 6 years or more. She was a great mentor for me when I wanted to understand microdosing and how to do it well and the integration part. She was one of my favorite coaches. And Ashley as well has been in the space for a very long time and are very, very versed in the subject matter and in the different ways to use that different medicines for different ailments or to optimize or to get out of your own way. So it's a very good pleasure for me to introduce the ladies today that's gonna answer your questions about psychedelic and highlight that space. Thank you. Welcome.
So before we start, I want to see a show of hands. How many people are here to find out more about ketamine specifically? Okay, amazing.
More about other psychedelics? What are you guys here for?
Psychedelics? And how many of you are interested in this topic as it pertains to mental health? Okay. Cool, now we know. So we'll start by just giving a brief overview of the different psychedelics that exist. And there's ketamine, which is the only legal option in the US. And this works on the NMDA receptor. So it works differently than all of the classic psychedelics. Classic psychedelics are considered things like DMT, mescaline, psilocybin, LSD, and these work on the serotonin system. And then you have ibogaine, which is a completely different animal. And kind of if you want to touch on that a little bit before we dive into the ones that you probably are more familiar with.
Yeah, ibogaine is definitely a different animal. Are we going into kind of what the effects are of each of these?
Sure.
Okay. And the use cases. Okay. So we can start with ibogaine, the really fun one. Compared to other psychedelics, it lasts a lot longer. It's indicated historically most for PTSD, but recent research has shown how great it is for physical longevity and the brain itself. A recent study out of Stanford did show that the brain's age reverses by about 1.7 years on average with one large treatment. I realize we didn't give a background of ourselves. We'll do that after. I worked for a bit at Beyond, which is an ibogaine clinic in Mexico, where it is legal to use. We treated a lot of veterans who had a lot of not just PTSD, but injuries in their brain. One really interesting case study last month that I was reviewing was this veteran had three basically black holes in the brain. There was shrapnel in the brain, and they were very large. One was, you could say, 1 inch across. The others are about 1/2 inch. He did ibogaine, and 60 days later, those holes were obviously they're not holes, they're just dead matter, reduced by about 50%. 90-day follow-up, it was down to about 10 to 15% of the original size. So that's how much this stuff is helping regrow the brain. And so it's an incredibly interesting compound, mostly because we still don't know exactly how it's doing all of this, versus with the other compounds we know a lot more, we've researched a lot more. But yeah, that's a little, we can touch more on ibogaine after. But
what is ibogaine?
Ibogaine is a root bark. But it can also be synthesized. Actually, last week a recent paper came out of synthesized from, I can't remember the compound, I sent it to you, hydrochloro something. But it's from the iboga root, which actually takes a really long time to grow. So there's some sustainability issues with it if it's not cultivated ethically and giving back to the people who, back in Africa, created it. However, it is easy to synthesize, and that's what a lot of treatment centers are using because it's also easier to rely on. So it's the iboga plant synthesized into ibogaine, which is one of the main alkaloids. So iboga itself has about 17 or 18 alkaloids. We still don't know, there's even more alkaloids to that. Ibogaine is probably arguably the most under-researched psychedelic, I would say.
And touching on the research, so when we research a drug, so quick background, recovered physician, have my medical degree, don't practice medicine. I wasn't buying what I was selling, and that put me on this path to work in psychedelics. Amongst other things, I learned that, we're working with a very limited toolbox in traditional medicine, but all of the things that we consider not science is actually all the stuff that makes us better. So a lot of the things here at the Biohack Lab, movement, nutrition, self-compassion, all of those, woo-woo things. Community, yeah, like all the things we know that are important, sunlight, proper nutrition. Medicine doesn't look at that, and it tries to reduce everything to the simplest thing. So we study some of these psychedelics in clinical trials, but we study psilocybin, so just the magic in the mushrooms, like just that molecule. But it takes away from a lot of the potential benefits, because think about cannabis is medically legal here. So a THC vape versus smoking the flower, very different effects. You still have the active ingredient, it can do some of the work, but it's different. And so when we study things, we try to make it simple. Psychedelics are not simple. Ibogaine, like iboga, is going to be a difficult thing to study because it's a dirty drug. What I mean by that is it hits so many different receptors that we don't actually know where the benefit is coming from. Ketamine is similar. We know that it works on the NMDA receptor, but it also works on calcium channels and the opioid receptor. So it's hard to study psychedelics in the way we've learned to study things, and perhaps that means we need to study things differently, but that's a whole other topic for us. And just like you said, quickly the background for you.
Yes, I have a background in marketing and operations, and I guess 6-ish years ago when the psychedelic industry started to boom, you could say, I went from helping companies that were more similar to Biohack Lab, like wellness, alternative wellness, with their marketing, and just ended up in the psychedelic sphere and helping physicians, healers, if you want to call them, they call healers. We heal ourselves though. But helping them bring their message to market responsibly, because one of the things we also see in the psychedelic world is like, this is going to cure your depression, kind of like, they advertise Prozac, and it's 20% the molecule and 80% what you do with it and what you do with your community around. So I worked a lot with people to get their message across responsibly. And also my ibogaine experience was working specifically with a ibogaine clinic, as I mentioned.
And so how many of you here have heard that ketamine will cure your depression? Yeah. And so it's unfortunate the way that the messaging has come out, and it made sense. Like initially we want to get everybody's attention, we want to present this as like this silver bullet, but the reality is you're not going to be marketing. It's like ketamine can cure your depression if you're following a protocol of preparation and integration, and you're following up with your community, and you're eating better and sleeping better and doing the things that are going to allow you to live your life better. So that's not like a sexy marketing thing. So, but that's actually the truth. And so I was a director of strategy for a ketamine clinic for 3 years, and it was right when all of this started to come out. In 2019, ketamine received breakthrough therapy designation from the FDA, so they were allowed to really fast track a lot of the research around using this for depression. Right now there's only one indication for ketamine, and it's only for Spravato, the nasal spray. And that's treatment-resistant depression, and there's major depression with suicidal ideation. The reality is that ketamine is an incredible drug for acute suicidal ideation. So suicidal thoughts, somebody that is in active, depth of despair, in 45 minutes after a treatment, the suicidal thoughts go away. but they don't go away forever. But this gives somebody a fighting chance. You can actually figure out, like, okay, what got me here? And what do I need to change in my life in order to not get back here? But it's not, like, that's the only part of ketamine that's really like overnight. For everything else, it's an overnight opportunity. And so I'm one of the coaches for Neuropain Health. It's a clinic here in South Florida. Dr. Michelle Weiner, she's one of the top cannabis providers here. And she's always been talking about, like, how do we get people off of their medications? When she was working with cannabis, it's how do we get them off of their opioids? How do we help them lower their mental health medications? And so when she started working with ketamine, she was like, okay, but how do we actually help people? Because the ketamine on its own, it's not going to do it. How do we create those structures to actually assist them in making the changes in their life that they know will make them live better? So we understand that ketamine, for the first, like, after you have a dose, 7 to 10 days relief from the burdens of your symptoms. And it varies per person, per dose. Like, again, hard thing to study because there's so much variability. But what the ketamine does, and a lot of the psychedelics do as well, is they give you this period of neuroplasticity. So neuroplasticity, how many of you have heard the word? A lot of times they talk about neuroplasticity is this great thing. Yeah, but depends on what you do with it. Because if you are depressed, neuroplasticity made you depressed because it's how your neurons wire together. So over time, you strengthen these connections of a depressed loop, of an anxious loop. And so for us, we explain to people, like, neuroplasticity is this period of time that you have after a dose. So what are you going to do with it to create the new habits? And, like, neuroplasticity, when you go home after a session to a toxic relationship and turn on the news and then doom scroll, is actually going to strengthen that loop. So we are very big on explaining this to people because the last thing that we want is for somebody who is already coming to us probably as a last resort, and for them to think that they failed this too. And this is the thing with a lot of the psychedelics. Some people will go to a psilocybin retreat and they're like, or an ayahuasca retreat, and they're like, oh, this is going to help me. And it helps them for a couple of weeks while the medicine is still working through them, while they still have this, pink, rose-colored glasses on. And then they go back to where they were and they're like, oh no, I failed this. There's no hope for me. And we always say, like, you didn't fail. Like, going back to the old way is actually part of the process. Relapse, whether it's relapse with alcohol or with people pleasing, whatever it is, that's actually part of the process. And what we tell our patients is that how will you know that you're growing if you don't revisit the old experiences and have a different outcome, even if it's slightly different? I'll stop there for a second if you want to comment more on ketamine or anything.
There's so much there. I think you also touched on how people can go and have this great experience at a retreat or from a ketamine situation, and they can also, if they're not doing the research, there are unfortunately situations where the providers aren't amazing or have everybody's best interest in mind. So it's also possible that, especially if you're not doing ketamine where it's legal, if you're finding these, again, anything we talk about today that is not ketamine is, research-based only.
Disclaimer.
Disclaimer.
We're not recommending.
But it does take a lot to understand what you're entering. And a lot of people actually don't do well in a group of 8 to 20 people in a psychedelic ceremony. And that can re-traumatize in some instances. And it can also just not be what's good for the person at hand. At the same time, it's also really powerful to witness in community the healing, because then you can learn from that healing. So one of the things I know you guys at Neuropain Health work at, but that I always try to speak into people to think about, is before you do a psychedelic, get aware of your baseline. And that's often hard if someone is, at their wit's end and it's a last resort. But you can kind of know if, okay, sitting in a group with a dozen people doesn't feel right. But sitting with a practitioner to do ketamine alone, that feels okay, that feels safe. So it's really important to prepare, and if you're speaking to anybody doing these psychedelics, to, at the end of the day, be in touch with what feels right for you, because forcing yourself into a mind-altering and expanding experience is not something you want to do if you are uncomfortable.
And this is actually something we see often when you're about to go to a retreat. You are going somewhere, perhaps where it's legal, but you still live in the US. So maybe you went to Jamaica for a psilocybin retreat. There's a little bit of more safety there because you have, again, a legal framework. But when you have this experience, you are it can bring things up for you, which is good because you're able to process it. But if what it brings up is oh my God, I'm doing something illegal. Oh my God, what's gonna happen? If anything goes bad, where am I gonna go? That can completely change your experience in the journey. And so we talk about there's no such thing as a bad trip. I feel like there's merit to that because in the right support system, afterwards especially, if you're lucky during, you can make sense of whatever the bad experience was, whether it was a lot of anxiety that came up that you weren't able to get out of this, or really dark material from your past that you remembered, or feeling unsafe in the situation. You can really work through this in your integration and figure out okay, what was there for me. But the ketamine experience helps with that part, at least with that part. It's a softer entry into a lot of this work. So if you are having a bad experience in ketamine, meaning some visuals are coming up that are very scary, you take your blindfolds off, you take your headphones off, and you're kind of woozy, but you're not having active visuals. If you ate a bunch of mushrooms and you are in hour 3, your eyes are open or closed, you are seeing things, and that could be very scary and destabilizing. And so, 6 years ago, the conversation was starting. But now you have New York Times, Washington Post, all of these bigger names talking about psychedelics, normalizing the conversation, not really giving you the guidebook. And so people are going off and they're doing these things on their own. And when you do this on your own, and we know people who have had these experiences where they're I'm a clinician and I know that if I go to anybody right now, they're gonna call me crazy. And so you're stuck in this place where you have to essentially, in the privacy of your own chaos, try to move through one of these negative experiences, because you can't really go to the Western model because they're going to say in your note you did drugs. They're going to probably medicate you. They're going to probably flag your chart with whatever their interpretation of this is. But this bad trip, when working with a guide, working with a coach, working with a therapist who's informed, can actually be the beginning of you changing your life. So I said a lot there, but what I want to say is that what you were saying, knowing what makes you comfortable, knowing what your pain points are, and then selecting the place based on that is going to be key.
So if somebody wanted to know where to start, so your suggestion, if I hear correctly, is start with the ketamine and assist it. So if I'm very new to all this, where do I start? So a lot of us just don't know. We hear about all that, we read about it, but we don't know. So what would be your suggestion as to where do you start?
Okay. If you asked me 6 years ago, I would say, well, microdosing mushrooms is great because it's such a light experience and it's fine. And I still hear people say that, but the reality is that we don't know how any person is going to react to anything. So I have a friend who's an addiction psychiatrist. She won't even teach her patients meditation without assistance, because she says that these are people that struggle with addiction oftentimes are already really connected spiritually to something, makes them very sensitive to everything around them. And so when she gives them these exercises, they can actually have such a psychedelic experience sober that it freaks them out. And so a microdose, we don't know who is, super connected already. We don't know what anyone is struggling with. And even a microdose can be a really big experience for someone. So it like that wouldn't be where I start people, what direction I'd put them. The ketamine, like we were saying, it's a great start because, especially in our clinic, like we don't have a set protocol. Anybody that doesn't quite understand how to navigate the intricacies of like personalized medicine. But we start with a low dose and we increase gradually. So we also don't say like you're going to be coming in twice a week for 3 weeks. Like we say come in for one session, do your prep coaching, do your integration coaching, decide what the next step is for you. So that's a great way to enter this because it also starts to bring back some agency to patients. If you have mental health struggles, you've probably gone to a doctor, they told you who you are and what your problem is, they gave you medication that you're going to take, and they just continue to give you that. If you said, I don't think this medication is good for me, they say, no, just keep taking it. It takes a few weeks to work, and then it takes a few weeks. You're like, I have these new symptoms, cool, we'll give you another medication. And you really lose your agency over time. And you start to doubt yourself, so you don't know how to actually advocate for yourself. We try to flip that completely. We're like, hey, how do you feel? Do you feel like you're ready for a higher dose next time? How long do you want until your next session? And this starts the patient to start, like allows the patient to start thinking differently about their own care, and they become an active participant in this journey. So that's why I'd say start with ketamine, because you can navigate it. There's different options. For some people, insurance will cover the nasal spray. That's a very low dose. And it allows you to work your way up to a much higher dose that could be this really big psychedelic experience. But in the meantime, you get a little bit of something from each session.
Would you say, also to start, you need to have a very clear intention and goal, as opposed to approaching something like this not from a place of power, so you're putting the power either in the drug or the psychedelic or the practitioner, but if you yourself, you need to have a very as as possible intention and goal for what you're working towards.
Well, Dr. Wiener, who we work with a lot, likes to say that all of these things, from cannabis to ketamine to anything you use, is really a non-specific amplifier. So if you do not choose what you're going to go in there and amplify, what's probably going to be amplified is something along the lines of those patterns that your brain has already created. So in order to have the a more optimal experience would be to utilize the power that's within you to have these intentions, especially with working with a coach, especially with working with your community, not only to have the intention set at the beginning, but also to have accountability partners, like I have right here. But it's super important to set an intention, and you might end up coming out of the experience with something that like doesn't really seem like it was the intention at all, but when you integrate and you work with it, you kind of realize, you walk it back, you're like, oh, okay. But yeah,
again, if you don't, one of the best questions that I started asking people is, they come in, whatever it is that they're coming in for, and I'm like, okay, what does better look like? And if they don't know the answer, maybe this isn't the time yet. And it doesn't mean we just send them home. Sometimes we'll actually sit there with them for like 30, 45 minutes, because I'll get this answer, I just don't want to be depressed. Like, amazing. What does that look like? Well, I wouldn't be depressed. I'm like, okay, so how does your day change? What does your morning look like? How are your relationships with people? What are you doing differently with work? And if you don't know what better looks like, you won't know that you reached it. So this is similar with chronic pain. They come in with a walker, pain is 10 out of 10. They come back the next time after an intervention and they walk in, no assistance. You ask them, what's your pain? 10 out of 10. It's like, really? Because you just walked in here very differently than last time. So it's like we don't notice where our wins are. We get stuck in focus on the negative parts. And so if you tell me that I don't want to be depressed, but you come back and you do a PHQ-9 assessment and it says that you still have depression, that's one thing. But how's the quality of your life? Are you spending more time with your intimate partner? Are you yelling at the kids less? Like, really getting granular helps you know what you've achieved and allows you to sit with your wins, and it allows the coach or the therapist that's working with you to highlight that for you, because as a society we tend to really sit with our losses and beat ourselves down, but move so quickly past our wins that you don't even give yourself a chance for the medicine to start changing your mind. And a lot of changing your mind is changing how you view yourself.
Somewhat related, but not really psychedelic related. There was a study that came out that said across cultures, I mean, most humans have like the voice inside their head, and only the Americans in the study, out of all these cultures, were the ones whose voice was negative, about 99% across the board. This is compared to, Eastern cultures, Southern American, everything. America was across the board, the negative voice.
Hi, I would like to know, what about drug tests for work? If we start with ketamine or microdosing, would that appear on the drug tests? How does it work?
So ketamine will, and this is actually a big problem with the police department. Like, we've tried to do initiatives, like they have a lot of PTSD, and we're like, let's take your people and do treatments. They get the same ketamine when they go get surgery, and they're like, we can't because it's an illegal substance. So this is kind of not there. I think with psilocybin, I'm not sure what test would show that. I mean, I think like a poop test, hair. So and this is another reason why ketamine becomes the option that people go with, because there's a legal, like you have a physician treating a condition, so like that's how it'll be. And so like in terms of drug tests, those are the things to keep in mind. Is there further question there?
So basically, if I'm following a coach, for example, and then the coach prescribed me ketamine, for example, would that be okay for a drug test to show to your employer?
So I would hope that a doctor is prescribing the ketamine and the coach is working with you.
Exactly.
But you can have the physician write a medical note that says, like, patient is under my care. So there would be a legal reason for it. But it depends, again, like it's legal, and then the police department would not have anything to do with it. So it really depends on where you're working.
Okay, thank you.
It's a big problem. People smoke marijuana, even in states that it's legal. It's a big problem with people who smoke marijuana. If you go for a commercial driver's license, you test positive, you flunk, you
Yeah.
can't drive.
Yeah. There's a lot of problems here.
So basically, is there an alternative if someone wants to, let's say I'm very depressed and that's my last option? What can I do about it? Not have a job and treat my depression, or you see,
Well,
it's very complicated.
Are you, like, if you're drug tested weekly, that's a different story. If you're drug
Okay.
tested monthly, like it shouldn't be in your system. It's not like cannabis that's there for like a month, or how it depends on what you smoke.
Okay.
Yeah,
It's like 2 days, right?
something like
Max.
that. Yeah.
Yeah.
Okay, thank you.
Yeah. And so we focus ibogaine, ketamine. There's also MDMA, which was used for PTSD in veterans. It was a very exciting thing. They were around. MAPS, the company, rebranded to Lycos. They were around for like 35 years trying to push this forward to reschedule and make this an option. And the FDA was like, you have all this therapy involved, and we don't really know what to do with that. So there's a lot of other issues, but essentially what we thought was going to be like this big shift didn't come through. And it changed how some of these clinical trials are starting to work with psychedelics, where they're realizing like, okay, yes, we know the ideal way to work with these medicines is to give you preparation, integration. Like when we did the psilocybin for major depression study, we did 4 to 5 hours. It was me and a psychiatrist sitting with the patient, and they just tell us their life story. When was the last time you had a psychiatrist sit and listen to you for 5 hours and it didn't cost you a fortune? If you can even get them for that long. So one, you already start this. You have two people who really care about you, listening to your story with no interruptions. And then we give them food. Then they come in for their treatment dose. Like the dose day is a 7-hour period. Yes, it was unfortunate when some people got the placebo as part of the study. But that was 7 hours that there's two people that care about you holding that space for you. Like really, you know that you're supported, you're safe. And then the following day, we talk to you for 2 hours. A week later, we talk to you for 2 hours. And then 2 weeks later, we talk to you for 2 hours. If your therapist did this, you'd probably feel better.
Without psychedelics.
Yeah. Like if your doctor called you after starting you on an SSRI and really listened, like, hey, so how did this go? You'd probably do a little better. And so, but this makes it very messy for clinical research. And MDMA, they tried to do, like they had like 60 hours of coaching, like of therapy with it. They tried, and we saw that the system is not going to welcome this. This study, they're able to do some of this because they know that it's important, but how is this going to be brought to the masses? Like when you actually bring this to mainstream healthcare, we realize that the system is not built to apply this kind of care. And so, yes, we're studying LSD, which is, the providers have to sit with the patient for 12 hours because that's a much longer thing. Nobody wants to be in the placebo trial for that. And you have things like DMT, which is DMT is an ayahuasca. It's actually a really short-acting drug when it's smoked. But with ayahuasca, they brew it with an MAOI, and it makes it last longer. But other than that DMT, which is a very short-acting, probably doable in a clinic, but there's a lot of issues there because they're not looking at the therapy around it. Most of these medicines could not be plugged into our system, which is broken. So there's a lot of talk about like, well, then it has to go to the underground and it has to be these practitioners. And at the end of the day, 80% of the benefit of any psychedelic is the prep that comes beforehand. That's education, that's self-inquiry, that's setting your intentions, that's knowing why you're coming to this. And then afterwards, the integration with community, with whether it's a therapist, a coach, a functional medicine doctor, a biohack lab, whatever that follow-up care looks like in that community setting. Like that's really what the benefit is. And then we look at the different drugs, different effects, different durations. But I think we really are missing the point in a lot of ways, which is it's what you do before, after. Like it's really not about just the psychedelic. It just opens a door because we are so used to the way that we think. Like we're so used to, oh, this isn't gonna work and this never works and I've always been like this. And the psychedelics kind of shake that up a little bit, and then you have this invitation. How do I want to view myself? What behaviors do I want to participate in? How do I want to show up at work with my family? But if you don't create those extra changes, it just becomes an experience in your kind of rear view mirror. And the worst part is there's certain things you can't unknow. You can't unknow that you're in a toxic relationship, that you hate your job, or that your diet is the worst. Living at the superficial level, you're like, fine, like, okay, whatever, this is what it is. But then you kind of like see underneath, and now some people can actually feel worse if they don't have that proper support afterwards, because they realize things in their life that aren't serving them, but they're not doing anything about it. So now they have that awareness that before they didn't have. So it's like it makes it really important to know why you're coming into it, and are you ready to let go of the things that are making you sick?
And then there's the aspect of cognitive dissonance, which is like lying to yourself. And there's research on that shows it's like one of the worst things you could do. So like if you're going to say you're going to do something and then you don't do it, you have this like internal shame, and your brain has all this stuff going on underneath of like that leads to some form of self-hatred. But if you do psychedelics and then you see these things that you want to change and then you don't change them, now you're worsening yourself because you've created that period of cognitive dissonance. And to your point of seeing things and then like going back, you can kind of think about psychedelics like a car wash for your brain. Like you can wash the car, but it's still gonna get dirty again. Like you have to do what you need to do to keep the brain clean and keep doing the things that keep it in running order, and then maybe you don't lead to psychedelics as another brainwash. Now you've learned diet is actually helping, or biohacking, or meditating, or making an effort to spend 2 days a week with community if you work from home, and all of these types of things.
And thank you for highlighting that, because it's, some people are like, the same ones are like, I just don't want to be depressed, or I just want to be happy all the time. It's like, really? Because that's not ever going to happen. So can we change that a little bit to be like, I want to be resilient when things do suck. I want to be able to have some emotional regulation so that when I am activated, like, whether you have a big emotion and you shut down, you have depression. You have a big emotion, you get nervous, that's anxiety. So I want to learn how to regulate my emotions a little bit. That learning of resilience is what is really the goal of that post-psychedelic experience. And it's understanding like nothing's ever going to be perfect. And so how do you want to show up when it isn't? And how do you enjoy when it is going well? Because that's another big thing for people. They're like, things are going so well, I'm just waiting for the other shoe to drop. Like, wow, that's a terrible way to go about, because you're missing so much of the beauty of what you've worked for or what's in your life. And so it's this big thing about resilience. And how do you do that? You practice it. And the psychedelics, some of you may have journaled before, you've done breath work before, you've tried meditating before, and you're like, no, I don't do that because it doesn't work. And what we say to people is like, well, you've had all these years of collecting tools. You just threw all the tools into this toolbox. It's a very messy toolbox. I wouldn't want to go there to look at anything either. But after a psychedelic, you come out with this very organized toolbox that is like, obsessively labeled for every little thing. Like, when you have this, use this. And so now you can actually revisit tools that you spent time, you spent money, you spent effort learning, and you can revisit them and see that they actually work. And it's like what we were saying with psychedelics, connecting you to yourself, that inner healer, that we're so disconnected from our bodies that we will even not notice when something is beneficial for us or harmful for us. And so now you can revisit the journaling and like, wow, something's actually like calming in my nervous system. Like, I feel calm. And I personally did this. I have a journal entry somewhere in my journals where it's like, I was really frustrated in the moment and I started journaling and I actually wrote, is this really fucking working right now? Like, I was frustrated that it was actually working, because I'm like, wait, like I've had this tool for so long, but it's so like the psychedelics will connect you to the part of yourself that knows what you need, whether it's a new diet, a new protocol here, like you can actually start to feel those differences, and then that becomes your guidance. So you need psychedelics less and less over time.
First of all, I want to say that I love everything you guys are saying because it is so relatable. Everything you're talking about is really what everybody is thinking every day in their life. Everything is tools at the end of the day, and the root cause, you mentioned it already, which is the negativity bias that we have all been conditioned and programmed from infancy in this current society. And having a job, if a person is trying to heal, but they can't heal because they're worried that they'll get fired from the job, is right there also the root cause problem, because you shouldn't be at a job that doesn't allow a person to heal, but yet we're trapped, and that is also the root cause. So basically all these things you're talking about is really cracking the code, or helping to really just crack the root cause, the code of how broken we've all been due to a system. And these tools are just helping with this awareness and this clarity and this guidance and this coaching. And I just think it's amazing what you're talking about.
Thank you. Thank you.
We have a question on Zoom. The question is, after a ketamine therapy, do you recommend microdosing?
We do not recommend anything that is not legal. But this happens a lot where people, like, and I've heard this outside of ketamine too, where people will either microdose a little bit as they move closer to a big journey, or they will microdose after a big journey to essentially stay connected to that that state of being. And I would caution on mixing things, because or find out why the microdosing afterwards. Ketamine on its own could be really beneficial if you are doing something with it. If you are sleeping better, you are whether taking on something different, like something that snaps you out of your old way of being, then the question would be, what is the microdosing supposed to do more of? If it's to prolong the ketamine effect, again, we know that the ketamine effect is prolonged when you do something with it differently. And the way that this has been described sometimes, maybe you've heard it, but it's like the ski slope analogy. So the usual way of thinking, being, acting, that is the black diamond, the green, whatever, the blue line. And these are well-traversed pathways that are they're there. And then you have a fresh snow. So when you have a fresh snow, it becomes easier to go around the bend or go around this tree. And the more you do that, the more you have this kind of pathway over the next 5 days after the fresh snow. And what ends up happening is the snow does eventually melt. And if you've been going around these bends, then you have a chance to go into that new pathway. But if you've done absolutely nothing, it's those old grooves that show up. Those grooves are your thought patterns. Those kind of different bends are your new habits. And so even if you try to make changes, you still may see those old patterns come up, but you at least know that there's another pathway somewhere that you can take. The microdosing, and I'm guessing they were talking about psilocybin microdosing.
You didn't specify it.
But it's again, like you were saying, the non-specific amplifier. So if you did a ketamine treatment and you feel some stuff coming up that is difficult, when you microdose, it may either it has the potential of bringing that up even more to surface. But the point of all of that is for you to be able to metabolize it and work through it. So it's a long-winded answer, but we don't recommend that for a number of reasons. People do it, but with anything, know why you're taking it. None of these psychedelics are meant to be, in microdosing, it's not meant to replace your daily SSRI. I've sometimes referred to it as antibiotics for infectious thoughts. And so you're not going to take antibiotics forever. You'll take it for 3 weeks, and you'll reassess. Did it work? Did it not work? If you're just taking it to prolong the ketamine effect, but you don't know what the actual goal is, it's not going to be as effective as really being an active participant in the process.
On that, and I don't know the context of this question fully, but if you have just had a ketamine experience and now you're like, okay, now I want to do psilocybin microdosing, that is incredibly disempowering to your own capacity. I would recommend, if you were to explore microdosing in a legal area, to give yourself a significant amount of time, at least 2 or 3 months before exploring that, because you do want that period after you've done one psychedelic to play with your resilience, to learn how this feels now. You don't strengthen a muscle unless you use it. So if you're just going to hop to something else, then again, you're disempowering yourself and your own capacity to heal, and you're really kind of chasing a high.
And I think also you're using a crutch.
Yeah.
When again, that capacity to trust yourself or to have this new resilience, you have to trust yourself.
Yeah.
And not escape, just use it.
Thank you so much for everything that you guys are saying. I absolutely love it. I've been myself in many aspects of the psychedelic space for 30 years. And one of the things that I really, really came to see and feel when I started getting into work with ceremony is that the work starts after the ceremony. And that's not what anybody prepares you for. And so I'm fortunate to where I'm super in love with nature. I love feeling good through the food that I eat. I love supplementing. I love essential oils. And so I gravitate to that, but many people don't. And so as I work with people of different backgrounds and different focuses, ketamine always comes up. And I personally have very little experience with ketamine, and especially clinical models. And so I'm really curious to find out what your recommendations are for local clinical models for people who might want to go on their own accord, might want to go with their health insurance. I get the question all the time.
So there's a reason I'm at Neuropain Health, and it's because we do things differently. There's a huge there's no real regulation around ketamine right now. So you have, doctors that will prescribe you nasal spray, like to take home without real guidance.
Like receiving in the mail.
You could receive it in the mail through different
11
organizations.
weeks worth, 12 weeks worth.
Don't get me started. You have physicians, like you have clinics that are just a drip clinic. You'll come in, they put in an IV. Sometimes they'll just like turn on a TV for you, which this is an inward experience. So there's a lot of misinformation, and these are physicians that they mean well. They're not like trying to do harm. They're just so misinformed that it's hard to recommend going to a lot of these places. So Neuropain Health, it's, clearly I'm biased, but I'm here for a reason. There's also New Path. So they're in Delray, and they really kind of have this integrative approach as well. Those are the two that come to mind immediately. That's.
I would generally strongly advise against recommending for anybody to use the telemed like lozenges and the doctors that just give the nasal spray to use, because it ends up becoming truly just like a Xanax, like pop it.
Yeah, and this is like the thing that people, like I've heard this so many times, and when they started sending into the home was really the big shift that I saw, like culturally, where people be like, oh, I don't drink anymore, and then they like spray their nasal spray, and I'm like, okay. And what people don't know, again, these people think that this is a better alternative, it's doctor recommended, so there's this whole narrative, but the doctors aren't talking about the fact that this is a dose-dependent benefit. So a psychedelic experience with ketamine is higher doses, and you have this kind of big opening, you connect to something deeper. Low-dose ketamine is like you're saying, it's like a Xanax. It's a Xanax that doesn't put you to sleep. It makes you feel like you're on top of the world. And that is a slippery slope for people, because then it becomes hard to tell them, especially if they've had depression, that this thing that's helping their depression and making them a little bit, egoic is not being used correctly. But what I started explaining to people is regular low dose use of ketamine can actually worsen your resilience and put you right back to where you were. But one thing to touch on what you said, for what we notice with people is we will oftentimes try to get them to do prep, like a proper prep call, really get their intentions. And we learned that we have to do this as a discovery call, because people who are at the depths of despair, fed up, like whatever, it's hard to make them curious about something. So we try to pull it out of them on that discovery call, explain what ketamine is and isn't, what does better look like. And then after their ketamine session is when they really become open to essential oils, new nutrition, yoga, meditation, because all of a sudden their views of the world have shifted, and they're like, all right, what else is out there? Like what else? Okay, let's talk about that now. So in terms of
Trust.
Yeah. And they become curious. It's hard to be curious when you're devastated. Any other questions?
I think there might be a Zoom.
There was a question, it was in regards to ketamine, but we can't see the question anymore. From my understanding, okay, there it is.
Fun fact,
Do you-
Zoom is how we met. on a talk about psychedelics
Yeah.
during COVID.
another fun fact, she did the branding for the
Yeah.
for Biohack Lab.
Yeah.
Some of it, not all of it, but some of it.
So I got a question is, do you usually talk with clients when under IV ketamine, or is it preferable to take it before and after the experience?
Good question. So there's psychedelic ketamine assisted therapy, and then there's psycholytic. Psycholytic is when people talk during the session, and we are not, I'm not a therapist, so I very rarely am in there talking to them during. Most people that are getting psycholytic dosing, it's lower doses. So you're still kind of here, but your defenses are lowered. You're able to talk about difficult topics in a way that perhaps you're not able to at baseline. Very effective for different indications, like when you're really trying to get whatever traumatic event happened, really talk through it, or there's indications for that. For us, we work more with psychedelic dosing, which is the higher doses, and majority of people are nonverbal. They just kind of lay there and that's it. They're out for the count. It's an inward process. What I've started doing for people though is I encourage them to put their phone on airplane mode and record. And part of their homework becomes to go back through that hour and a half, 2 hours that they're sitting there and write down anything that they said. And the reason I started doing this is I had a private client that came in and she would talk throughout the whole thing. And the things that came out of her mouth were so profound. And when I would bring this back to her in our coaching sessions, it would unlock this entire 20-minute conversation about what it really means. And so this gives the person an opportunity to essentially hear their own voice, say things that their higher self is saying through them. And it's a really cool experience because they get to hear themselves empower themselves, and then they bring that material to the coaching sessions and it becomes so much more robust.
And that's common across the board. People tend to speak audibly when they're under, or
I'd say maybe 20% of people, but here's the thing, if you know that you can, people will try to,
sure.
We tell people listen, you're gonna have a really profound thought and you're gonna try really hard to hold on to it. It doesn't matter, it's not gonna stay, you're just gonna go at one point. And it can be frustrating for people because they're oh, I had these amazing insights. But this allows them to just say okay, call this person, whatever thing comes up for them. So if you know, because before we'd have it that they can, press a button if nobody's in there with them, we could come in, we could record something, but that creates a lot of thought process that has to happen. And this, not everybody wants to record themselves, but the ones that do tend to have a really cool experience with that.
I wanted to ask, has there been any experience with dementia and the depression that comes with that, and working with ketamine to perhaps alleviate some of that?
So people are looking at different psychedelics, but with ketamine, it depends on where you are in the kind of decline of dementia, because these are also dissociative experiences that you may not want to put somebody through that who's already kind of struggling. Yeah. And so however, it's something that, when you're starting to have some cognitive decline, I know people who have come to ketamine, they'll get maybe a session once every 6 months, but it helps with some of that mental clarity, because there's a lot of things with dementia. It's type 3 diabetes. It's so there's elements there that, yes, it's a neurological manifestation, but it doesn't actually start there.
There should be first course of action.
Yeah, it's this general question for my dad. I mean, he's way down the line, but and it makes sense. I mean, obviously, I can't explain to him, hey, are you okay with this?
Right.
No, that's just not the situation. But if there's a way to find,
I've been seeing a lot more studies with Ibogaine.
Yeah.
A lot more, even for MS.
Yes.
I saw last week there was a study that came out, and one session had such a powerful impact.
Yeah, it
So,
was 2 case
I mean,
studies. In
there's
that,
a lot
yeah.
going on with, but I would love to hear a little bit more about that.
So that study was 2 case studies of people with MS who, yes, had drastic improvement, and truly drastic, like, which I caution anybody saying in the psychedelic world, obviously, but with ibogaine, it's like this outlier where it has proven time over time to improve cognitive function in people, whether it's due to brain injury or MS is now what they're studying. Working in the clinic or the center that I was at, I mean, we would have, it was 20 people there any given day, 365 days a year, and they don't have published case studies, but I can tell you that every person I saw that came for cognitive issues, whether it was concerns about Alzheimer's or, again, the brain traumas that led to cognitive decline, they found improvement. I don't like using always and ever and every. And you also need to keep in mind that ibogaine is not like ketamine. It is not like psilocybin even. There's a lot of contraindications when it comes to medication, as well as heart strength. You have to have a very strong heart.
Right.
And so
if you have dementia, to get to the place where you can actually ingest
Yes.
it.
Yes. So ibogaine is great for people who are in a position where they feel they need it and their body can handle it.
And she said earlier that it's a long trip. It's like 18 to 24 hours.
Yes. Yes.
So,
it's a commitment.
yeah, to say the least. And
There's centers in Mexico?
Yes, it's legal there. Yeah.
the also it's something to touch on. So ketamine, why it's also oftentimes a good entry point is because you can pretty much take ketamine if you're on most of the medications that people are prescribed for mental health. With other psychedelics, you know, there's contraindications, there's serotonin syndrome, there's you have to have a washout period before you get into a psilocybin trial, definitely before you go for ayahuasca. But with ketamine, it is not contraindicated. So we'll have you hold your medication, you know, in the morning or the night before, but it is much safer to take when people are starting in the Western world where there probably are, which is polypharmacy.
Yeah.
I have one last question.
Yeah.
It's really out of the box.
Which one do you guys would say helps increase intuition the most out of all the spectrum of psychedelics?
Do you want to answer?
So
I have an answer.
you go. Hilarious.
Psychedelics, definitely.
You go. I have mine.
Well, I've always had this like theory that based on ancestry, a certain one will call to you based on where you were, like what psychedelics are physically grown, where you are ancestrally from. Of course, mixed ancestry. Then, are you mixing psychedelics? No, don't do that. No, space it out, like I said. But there's also, like, this is kind of woo, but especially with the entheogens, like the plant-based psychedelics, you do get to a point where you get called to. And I would say that is the one that would strengthen your intuition the strongest because you are called to it.
And basically, same. Get out of my brain, or sorry for bothering yours. Not everything is for everyone, and not everything is for everyone at that time. And so we tend to want this like protocol or this instruction from somewhere, but I actually think that as time goes on, as we have more research, we'll actually see some people respond very well to psilocybin. That's probably your medicine. Don't force yourself to do LSD. Like, there's, I think, going to be, I mean, everybody wants like the genetic marker for this, and maybe it is that level of complexity, but it's at this point, yes, whatever calls to you. I see this a lot of times, like, you should be doing, no, Like none of that. No, you should be, because that's what helped you. Maybe your inner healer connects to that medicine, but it's encouraging people to really feel into it. And if you feel inspired to do something, like you'll probably still be inspired in a week. So give it time. I wouldn't go into anything with urgency, because that's another thing. Like when you're going for something so profound, urgency shouldn't be the energy, or I recommend that urgency isn't the energy that you come to it with, even when you're in the depths of despair. Think about it a little bit.
If people want to find out what's out there and they want to know the 101, where can they start finding out about all these things out there that could, help them with their experience? Is there a place to start?
I know MAPS has actually some really good, well, now Lycos, I don't know what their domain is anymore. I think that
It's
this
still
word is still
maps.org.
MAPS. They have some really good like PDF files of like 101 of what these substances do. And then what's the company that has like webinars? Psychedelic Alpha. It's not Alpha.
Psychedelic Alpha has a lot of the kind of where things are legal, what are the recent news, any like biotech things, updates. Microdosing Institute in the Netherlands. I don't know if it's .nl or what, but they have really great resources for kind of just getting started with that. They've been around for, I want to say, a decade. There's the Blossom Network, I think, that has a lot of clinical trials, but I think Psychedelic Alpha could lead you to a lot of good directions, but Microdosing Institute definitely for that stuff.
Insta shamans are great too. I'm joking. Please don't take that seriously.
And if I could just add, to echo, I think what you guys are saying, to find a provider you really trust, that's a place where you can ask the questions that are most appropriate to you, your needs, your intuition, your own development. Because working with somebody one-on-one where you can build that relationship helps you to maximize your experience.
Yeah. Being true to you. There's a coaching organization. They've been around. They actually started with ibogaine patients, work there. So like the toughest clients with severe addictions, and I think they've been around for 12 years. And they work their way backwards, and now they support a lot of ketamine clinics. So we'll sometimes refer out to Being True to You, and they have coaches that are trained in transformational coaching with psychedelics. So they're a great resource, and it's also somebody that can stay with you if you go to one clinic and then maybe you go to a retreat, but you have the consistency of the coach that has known your process. I highly recommend checking them out as well if you decide. Being true to you. Yeah.
With ketamine, yes, but also just kind of broadly with the other medicines, are there certain mental health disorders that you would kind of list as untouchable, people may be unreachable through these means, or?
Schizophrenia is a big one. Whenever there's psychosis or mania in the diagnosis, right now, unfortunately, it's a really tough population to help because we don't have the systems in place to actually support someone that, let's say they have bipolar with manic tendencies, to catch them in that manic swing. And I think that will probably change over time once we learn a little bit more about this, because the same diagnosis of schizophrenia in the Western world is also an indication that you're perhaps a healer for the community in an indigenous tribe. And so we just don't know how to navigate this. And there's always the concern of, younger populations doing a psychedelic for the first time, the same way there's a concern with cannabis, putting them into a psychotic state. Like that's always there. But I think that's more of a testament of our not understanding how humans work, not just how these medicines work, and what these things mean. Like there's a huge part of the population hears voices. So many of them understand that it's not quite here. So maybe it's just a misunderstanding, miswiring that puts people into this shame spiral, fear spiral, medication kind of hamster wheel, and presents as we see it today.
My last question would be for somebody that is an active in a psychosis state or bipolar state. Is there any research as to a protocol of psychedelic that kind of help that person, transform or heal from that type of disorder?
There's no research, but I would caution about going back to psychedelics when in that kind of psychotic state, because if you think about them again as a non-specific amplifier, if you are in this really activated place, it's actually grounding that you need. Unfortunately, unfortunately, it depends on the severity. Like Western medicine will tend to give the medications that block the psychosis, and they kind of really dull people down. But outside of that, one, it takes time. It takes time and compassion, because some people will be so scared, the people around you are so scared that it creates even more alarm bells. And we've seen people that go into the psychotic state, and it's like you need them to have a support system, like a loving family member, somebody that's there. It says like, hey, you'll come back, it's going to be okay. That becomes a waiting game, because you don't know how long it's going to take for someone to come out of that, but they just need to know that they have that space to do that. Otherwise, we can see people Baker acted. We see people kind of put back into that, loop of medications, and that changes something for them. Like it doesn't necessarily, it can make them scared of their own mind moving forward.
Thank you.
Thank you, everyone.
Thank
Thank
you.
you so much.